name is Crystal Hernandez, and this is my daughter Ariel. We are the Go Red for Women ambassadors in Sacramento. We're here with Ariel's pediatric cardiologist, Dr. James Hill, with Sutter Health to talk about the connection between Down syndrome and heart disease.
Awesome. Hi, Ariel.
Hi.
Hi, Ariel.
Is that Dr. Hill?
Oh, yes.
Yeah. So Dr. Hill, as you know, Ariel was born with Down syndrome, but she was also born with holes in her heart. Can you talk a little bit about the correlation between heart disease and Down syndrome?
Absolutely. So we do know that children with Down syndrome are much more likely to have heart defects, but it's not completely understood why. About 1% of children with quote unquote normal chromosomes, 1% will have congenital heart defects, whereas in Down syndrome, it's about half. And so it's a variety of defects. And so, you know, it's pretty easy actually to remember, but I don't know if you guys can see the whiteboard, but so Down syndrome, about half are born with no congenital heart disease, and half have congenital heart disease. And out of those with congenital heart disease, half of them have something called an AV canal defect. And then the other half have a variety of other things, ASDs, that's atrial septal defect, ventricular septal defect, patent ductal arteriosus, and something called tetralogy of flow.
So Ariel recently underwent an innovative surgery, and her surgeons traveled all the way to Brazil to learn a less invasive way to repair the holes in her heart. What treatments are normally available to children with heart issues, and why are new procedures like the surgery that Ariel had are so promising?
So what I do is I'm an interventional cardiologist. So that means I fix heart defects, but I do it with tools that go into the bloodstream. I feed those tools up to the heart, and I can fix certain things that way. So blocked valves, certain holes in the heart. We can even implant valves that way now sometimes. But there's some things I just can't do that way. And so the surgeons have to get involved, and they have to actually fix the heart directly. So in order to work on the heart, they have to stop it, they have to empty it of the blood, and then they have to work on it and then start it back up again. To do that, of course, they have to take the blood out. So it goes, all the blood from the patient goes into a machine outside of the patient and then gets pumped back in around the heart so that they can work on the heart that way. Normally, the way to do that is through an incision that goes all the way from the lower neck area to the upper abdomen. So it goes all the way down the center, the sternum, and opens up. I'll just show you a couple pictures of the classic way to do these surgeries. Here's a little baby, and this is the classic way. But you can see it's a major scar. That scar will be with them their whole life. And you know, it's a major surgery, and it takes a long time to recover from that. And so, you know, our surgeons that we work with here in Sutter, Sacramento, they're Stanford surgeons, and they want to do things less invasively too. So they read a couple of articles, things that were coming out of different ways to do things. And they actually traveled to Brazil to learn these techniques. And a technique now that, you know, instead of doing the surgery this way, in certain cases, they do it this way. So it's a small incision under the arm. It sort of goes along with the skin contours. And so as the scar heals, you can actually see it less and less. And then, you know, it can be hidden under either a bra or a bikini later on, or just simply under the arm. And Ariel and one other little boy were around the same time, and they were the first, as far as we know, the first two patients west of the Mississippi to have their surgery done this way. So there's another surgeon in Pittsburgh. She's a Brazilian surgeon. She's done it also there in Pittsburgh. But so we are very proud to have, you know, the collaboration here and to bring this to our community and offer something that most hospitals don't do. So.
So the American Heart Association's Go Red for Women movement is all about living fierce and supporting women's health for their heart. What advice do you have for young girls who are cardiac patients like Ariel and their families on how to maintain a happy, healthy life?
So I think, obviously the first thing is going to see a cardiologist and having the hearts checked out. Most of the time this happens right after birth when you notice that the child has Down syndrome. Of course, if they're born with a heart defect, we try and do the best we can to fix it so that they can live normal lives. But even if they are the ones who have had their heart defects fixed already, or the patients who are born with Down syndrome that don't have heart defects, it's also really important to keep their hearts healthy so that they can live the rest of their lives healthfully that way. One thing that, I don't know if you guys probably know, is common in children with Down syndrome is they can get overweight very easily. There's a number of different factors that contribute to this. The slow metabolism overall in many children with Down syndrome, but also diet and activity. So activity is a huge one. I like to really talk to families of kids with Down syndrome and make sure that they stay really active. It's important to find something that the kids really like to do, because otherwise they're just not going to do it. So, we try and identify together things that they might like to do. I like to suggest team sports or martial arts or dancing, but really anything. Doesn't matter what it is. But if they can get their heart moving at least 30 to 60 minutes a day, that'll keep them healthy for the rest of their lives.
Was there anything that you wanted to kind of discuss before we wrapped up, like about the details, or anything that you wanted to share?
But I really think that the combination that we've built here in Sacramento, between our practice and between Sutter Medical Center and the Stanford Heart Surgery team, is awesome. It's a sort of rare type of collaboration between three different groups or individuals, but it's awesome. And we brought, Sacramento for a long time didn't have an amazing, great heart program that could take care of kids like Ariel, but now we definitely do. And Sutter is really supporting that. I think it's awesome.
All right. Thank you, Dr. Hill, for taking the time to join us. Definitely like these conversations, and we really appreciate you helping us raise awareness to support more families like ours who have children with Down syndrome and heart disease.
My pleasure. And thank you, Crystal, and your whole family for being such for all
Thank
these
you.
children. Like Ariel. Ariel!
Bye.
Bye-bye.